My name is Bryan Beardsley. I'm a medical doctor with subspecialty training in orthopedic surgery, and I work here at TriState Orthopedics. I certainly enjoy spending time with my family. I have 2 daughters and a son. My outside activities that I enjoy doing are things like jeeping, anything pretty much that gets me in the mountains. I like to ride dirt bikes in the summer, snow bikes in the winter. With snow biking, you can go find untracked powder wherever you want, basically, and don't have to worry about lines. My father was a physician, and his father was, so there was that kind of wanting to be like them, and I always kind of had the desire to use my abilities to help people. And orthopedics was not what I thought I wanted to do when I started medicine. Summer after my first year of medical school, I was able to do an anesthesiology preceptorship. And I was supposed to be watching the anesthesiologist, and when the orthopedic surgery case I was doing, I couldn't keep from looking over the drape, watching what they were doing, going, that is really cool. And so that was kind of when I decided, I think I want to do that. Almost all of our patients are coming to us in pain, and pain dramatically affects people's quality of life. Some of them haven't been able to do things for years. It's really enjoyable to be able to give that back to them, to have a patient who's been in miserable pain who comes to you smiling and no longer in pain is really a rewarding part of my job. When they first come and meet me, I want to know what they're experiencing, how it's affecting them, remembering that they're not just an x-ray or a body part. This is a human being that this affects their lives in a lot of different ways. Hip replacements particularly feel better so quickly, it makes it extremely rewarding. Those patients occasionally will wake up from surgery and tell me they hurt less than when they went to sleep. TriState to me was a natural fit to the type of medicine that I wanted to practice. TriState is growing. It has an excellent reputation in the valley. Providers want to work here. We're kind of on the cutting edge of even some of the bigger cities in what we do here. You know, we're using robotic assistance for our joint replacements. We're doing a lot of things that not everyone is doing, even in some of the bigger areas. I've had patients come to me from Alaska. I've had a patient that came to me from North Dakota. We do have a fairly large retirement age population. So I think the need is great here in the valley, particularly for orthopedics. And so anytime we can save people those travels, it's going to be a benefit for them and a lot easier for the logistics of recovering from surgery.